Hi, I'm Jess Andrews. I'm the Director of Resident Life at Carroll Lutheran Village, and today we're going to talk a little bit about the benefits of socialization and older adults. We've all heard of the fountain of youth, but what if the secret to living longer is actually your social life? Being social and putting yourself in social situations releases the neurotransmitters oxytocin and dopamine. These neurotransmitters are responsible for increasing our trust, lowering our stress levels, reducing pain, and increasing our happiness. They also increase our resiliency to stress factors. Being social decreases depression and anxiety. It improves memory formation and recall, and protects the brain from neurodegenerative diseases, decreasing your risk for developing dementia and Alzheimer's, which we'll talk about a little later. Being social also has positive effects for your whole body. It increases your self-esteem and your sense of belonging. It decreases your stress. When we're out and interacting with others, we are moving more and are more physically active. This can lead to improvements in our cardiovascular health, strengthen our immune system, and overall decrease our risk of chronic diseases, including type 2 diabetes, heart disease, and stroke. Older adults who live a socially active life and prioritize social goals have higher late life satisfaction than those who do not. What about the quality of our social interactions? Does it matter? The journals of gerontology found that older adults who interacted with people beyond their usual circle of family and close friends were more likely to have higher levels of physical activity, greater positive moods, and fewer negative feelings. The researchers asked 300 adults aged 65 and older to record their activities and social encounters every 3 hours for a week. They also wore activity trackers to monitor their movement. They found that people who had more variety in their social interactions spent less time being sedentary. The reason? Scientists suggested that while older adults may be more sedentary when they're with their closest friends and family, they're watching TV, they're sharing a meal, they're lounging at home. They need to leave the house to engage with people that they don't have close relationships with, therefore being more active. So as a recap, socialization sharpens memory skills, improves mental health and self-esteem, delays cognitive decline, lowers stress levels, reduces risk of chronic illnesses, and gives a sense of purpose and belonging. All positive things we want to experience as we age. I mentioned earlier that being social may reduce your risk of developing dementia. So let's look at that a little bit. I know we've all heard of Alzheimer's disease, but let's talk briefly about what the disease actually is. It is a neurological disorder with devastating consequences, affecting approximately 5.4 million Americans and almost 50% of people over the age of 85. Research shows that the number of people with Alzheimer's is expected to nearly triple over the next 30 years. Dementia, in which Alzheimer's is included, is the most important contributor to disability in older adults. Despite all of these staggering numbers, there isn't too much the medical community can do. While pharmacological solutions can be beneficial, some medications can slow the progression of the disease. Strategies, like being social, are sometimes even more effective in improving the quality of life than pharmacological interventions. Often, older adults with cognitive decline are seeking a sense of control. Social interactions can be empowering to proactive individuals who seek to gain greater personal control over their mental and physical health. Social engagement is an important skill set for delaying the development of Alzheimer's and dementia. An increased social engagement can be correlated with angiogenesis, which is the increased blood flow in the brain, synaptogenesis, increased formation of the synapses in the brain for transmission of information, and neurogenesis, the process by which new neurons are formed in the brain. Scientific studies have found that loneliness has a direct correlation with cognitive decline and the development of Alzheimer's and dementia. What if you or your loved one has already had a diagnosis of dementia? Many Alzheimer's and dementia patients experience isolation from other people as a result of their disease. This often leads to anxiety, depression, societal withdrawal, and decreased self-confidence. Increasing the social environment of someone with Alzheimer's or dementia may help them regain a sense of self. Increasing the social environment of someone with Alzheimer's and dementia may help them regain a sense of self-worth and a better attitude toward life. Studies have shown that socialization may improve eating and exercise habits as well, which may result in an improved Alzheimer's and dementia prognosis. So what can you do to become more social? You can move to a retirement or a 55+ community. These communities often have clubs, trips, group dining options that increase your opportunities to be social. You can join a club or an organization. Do something you like with other people. Do you like to organize things? Organize those social activities. That extra step of organization has benefits for your brain. Connect with loved ones. Encourage yourself to step outside of your comfort zone and have lunch with a friend, or use technology to FaceTime with your grandchildren. Volunteer. Give a part of yourself. Participate in exercise classes. This has a twofold benefit. When you're socializing or exercising with a friend, you don't realize how hard or how long you're exercising, so you get a little bit more physical benefit. I hope you learned a few things today and were able to carry some of this information home with you. Thank you for having me.